If you and or your spouse are going to continue to work beyond 65, the question is, what are you going to do about Medicare? Now, folks, there's a lot of dangerous and very misleading information out there about this question. So in this video, I'm going to show you how you can avoid making any costly mistake and make the right decision about Medicare. Now, there are three very common mistakes that people make when they approach 65. And what I'm going to also do is share with you a fourth one, and I'm calling it a bonus to make sure that you avoid that mistake as well. So let's talk about the first mistake. This is for those who must go on Medicare. Notice the word must go on Medicare at 65. Now, keep in mind, we're talking about people who are working. Either you're working or your spouse is working, and you're covered by an employer-provided plan that's available to you. So what happens is Medicare says the size of the group of the employer actually matters in regards to who has to go on Medicare at 65 and who does not. And so these are called small group plans. So if you are or your spouse is working with a company, for a company that has 19 employees or less. Now, that doesn't mean to say those 19 employees are covered by the group health plan. It just means that's how many people that we have on the payroll. 19 or less, that is considered a small group by Medicare. Okay? Now, what's happened up to this point in time before you turn 65 is this small group plan is the first payer. In other words, they're paying the bulk of your health care expenses. And then the second payer is typically you. What's going on is you probably have some co-pays, maybe a deductible, you could have some co-insurance, but you have some out-of-pocket expenses. And that's the way it works up until you hit 65. Because then at 65, what happens is Medicare does this. Medicare tells small group insurance companies, those small group plans, that now they are going to be in the second payer position. So that small group insurance plan, and now Medicare A and B will take the first payer position. And so once we hit 65, this is the way it can work. However, if someone makes this mistake and they don't go on Medicare at 65, not understanding this rule, and they choose not to go on to Medicare, then what happens is then you will become the first payer. And so if you have some kind of a large claim, I can assure you as that claim gets processed and you have this small group, when that insurance company gets those claims, they're going to say, hey, we're the second payer and Medicare is the first payer. You say, well, I didn't enroll in Medicare, didn't know I had to. That doesn't change anything. Now they're going to say, even though you made the mistake, you're still going to be responsible. And if you had some serious health issue, a surgery or something going on where you were hospitalized, you will be in the first payer position. So anyone that's covered by a small group plan, you have to enroll into Medicare A and B and put them in the very first payer position. You have no options unless you want to be responsible as the first payer. Now, frankly, what a lot of people do once they've gone on Medicare is they go ahead and drop the small group plan, and they'll either get maybe a supplemental plan or they may get an advantage plan. Either way, they'll get a prescription drug plan. So they really usually come out of the small group totally because normally there's some out-of-pocket expenses. Your premiums could be higher than what your Medicare options would be. And so many times they just simply drop the group plan totally. And we find sometimes that the employer, of course, they were paying some of your health care premiums. Sometimes they'll actually give you a raise. They're not able to pay your Medicare premiums for you, but they could give you a $300, $400 a month raise, and they win and you win also. And again, that's something you'd have to negotiate. It's nothing they're obligated to do, but we find a lot of employers will do that. All right? And so most just go ahead and drop that, and they'll just go on some type of a Medicare plan, like I said, either a supplemental plan or an advantage plan. And so 19 or less, you have to go on Medicare. If you make that mistake, that doesn't change anything. You all of a sudden become the first payer. So that's anyone with a small group. Now, some of you are also covered by an ACA plan. This is the Affordable Care Act plan. This could be those of you that may be self-employed, or maybe you work for a small group and they don't have a health insurance plan available, so you enrolled into one of the marketplace plans. And the same thing is true for you as it would be if you had a small employer plan. And that is the ACA plan is getting you to 65, but once you hit 65, the ACA plan is no longer going to be financially wise for you. Now, technically, you can keep an ACA plan even at 65, but you'll no longer get any tax subsidies. You'll get no cost sharing. In other words, all the financial benefits of that ACA plan are going to go away once you hit 65. Yeah, you may have a very low and attractive premium that looks better than even a Medicare, but what's happening is the government is subsidizing that. And now once you're eligible for Medicare, those government subsidies are going to go away. And so if you keep that ACA plan, what's going to happen? You're going to pay full premium for the plan. You'll pay the full deductible, all your out-of-pocket expenses. And so there's no reason whatsoever to keep that ACA plan. So again, anyone 19 or less, or someone's on an ACA plan, we're going on Medicare at 65. Now this is key. You have to understand that when we go on Medicare at 65, what we're going to do is we're going to come into Medicare using what we call our initial enrollment period. And this is for anyone that is starting Medicare at 65. We have this 7-month window. So let's say we're going to go on Medicare July 1, 2023. We have 7 months to enroll into Medicare. That's 3 months before our 65th birth month, the month we turn 65, and then 3 months after. All right, so in my example, this would be June, May, April. This would be August, September, October. And again, this is the month that we're turning 65. Keep in mind, if you're born on the first day of the month, this whole schedule moves forward 1 month. So if I'm born July 1, then my effective month would be June. So when you're born on the first, they always start you your previous month. But if I'm born on the second day thereafter, it is my birth month that will determine when I'm going to be eligible for Medicare. So in this example, we're saying my birthday is July 2nd to the 31st, born 1958. And so I'm going to start my Medicare at 65. So my 7-month window is what? 3 months before, month of, 3 months after. But here's the key. If I have to start at 65, folks, you want to be sure that you enroll in a Medicare in advance. Because if I, in this example, enroll in April, May, or June, my Medicare is going to start right when I want it to, July 1. But if I wait for whatever reason, procrastination, confusion, bad advice, whatever, if I wait and I enroll during my birth month, my Medicare now will not start until 1 month later, the month of August. If I enroll in August, they'll start me in September. If I enroll in September, they'll start me in October. And then if I enroll in October, they'll start me in November. And so now my coverage, as you can see, is being delayed. And here's the problem. Now, what happens if I'm enrolling any of these months here, I can certainly do so because I'm still in my initial enrollment period. But again, if you have a claim, now you are during this time, you are the first payer because you have not yet enrolled in Medicare, and your group plan's only going to pay second once you've hit your birth month. And so it's too risky to do that. So my point is, you want to be sure to enroll in advance of your 65th birth month if we have 19 or less in the group, or if we are covered by an Affordable Care Act plan. All right, we want to take advantage of this initial enrollment period and again put Medicare in that first payer position. All right, now let's talk about the second common mistake that people make. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. All right, now the second most common mistake we find people will make is this. There's some who may want to go on Medicare at 65. Now, they don't have to go on Medicare at 65, and this is the group that they or their spouse are still working, and they're covered by a group health employer provided plan, and there's 20 employees on the payroll or more. Could be 50 or 500 or 5,000, whatever. But anything above 20, you're not obligated at all to do anything with Medicare. You don't have to take A, you don't have to take Medicare B, but you may want to. And so the mistake here is people oftentimes just take the kind of the easy route, and they've been covered by the group plan, and they're not really happy with it, but they're going to stay on it because that's what they've been on for several years. And so what happens is they don't take the time to compare. So that's the mistake, folks, not comparing. So what I'm challenging you to do is be sure if you're turning 65 and you're still covered by a group employer provided plan above 20, still take the time to compare. Compare your group plan with your Medicare option, and sometimes Medicare makes sense, sometimes not, but sometimes it does. So here's how you make the comparison. By the way, if you work with our company, we're happy to do this analysis with you and show you exactly how we would look at it. So number one, we're going to look at the premium. what does it cost you to be on that plan? Most of us contribute some, employer contributes some. So what is your out-of-pocket expenses for the premium typically coming out of your paycheck? All right. Then secondly, we're going to look at what is your deductible on the plan. What's your deductible? And then you also probably have some kind of co-insurance, which is typically 90-10 or 80-20. Plan pays 80%, you pay 20. Plan pays 90%, you pay 10. But you have co-insurance. And you probably have some co-pays as well. And then you have what's called the max out-of-pocket. All right? So these are the terms that we're going to look at. And let's just do a quick example. As I make a comparison, my rule of thumb is this. If you're paying anywhere around $200 a month for your own individual policy, or let's say $250 a month range up, if you're paying that much, sometimes Medicare is going to make more sense. Also, what's your deductible? Let's say you have a deductible of $3,000 a year. That's not uncommon. And if you ever meet that deductible, what's that mean? Well, I divide that by 12. That just means if I'm meeting that deductible, that's an extra $250 a month out of my pocket when I say spread that deductible out. So if my premium is $250 a month and I meet my deductible every year because of meds or other health issues, now all of a sudden I'm spending $500 a month. Medicare is going to be a better value than that. Okay, then we have co-insurance. That's at 80%. You pay 20, maybe the plan pays 90, you pay 10, but this co-insurance usually has some kind of a limit to it. And sometimes that's $5,000 a year. Sometimes I'll see a plan as high as $10,000 a year. And so if you had a serious health issue, what is that going to cost you? That's your max out of pocket. And so we're going to look at these numbers and we're going to compare those to Medicare. All right? And so what you're going to do, if a person goes on Medicare A, and B is right now for most people costs $164.90 a month. And then they may get some kind of a supplemental plan, and let's say it's a G plan. And again, I'm just giving you an example here. That may cost you $125 a month. And then we got a prescription drug plan, and let's call that $25 a month. So we're at $150 and $165 here. So we're just going to call this what, $314.90 a month. But on that G plan, all I have is the deductible for the whole year of $226 for the whole year versus this high deductible over here. So again, just look at the numbers. Take the time to do the comparison. Again, we're happy to help you. So a person here, $314.90 a month, and they have very little out of pocket other than a small deductible and some co-pays for their medications. So make this, take the time to make sure you do this comparison. Now, keep in mind what I taught earlier. If we're going to make this decision, while we're turning 65, we need to do this during our initial enrollment period. And sometimes people make the mistake thinking that they can only go on Medicare when the company has its open enrollment season. If you're going to start Medicare, folks, at 65, you don't have to worry about the company's open enrollment season because you have the right. It's called a life-changing event. You're coming upon Medicare eligibility. You have then 7 months where you absolutely can go on Medicare at 65, regardless of your employer-provided plan. You can go on Medicare. Now, keep in mind, let's say that we don't start Medicare at 65 and we keep working and now we're 67 and we're going to keep working, but now we want to go on Medicare. Well, then what can happen is that group plan does have the right to say to you, you can go on to Medicare, but you can only do it during the company's open enrollment season. That may be towards the end of the year, whenever it is. But at 65, they cannot say that. You can go on at 65, and if Medicare makes more sense, you want to do that. But again, we have 7 months to do it. So let's go back to my example. If I'm turning 65 during the month of July, I can start my Medicare July. I have 7 months, 3 months before, month of, 3 months after. And so you can start your Medicare on July, your birth month, by enrolling those 3 months in advance. All right? And that's for anyone that's still working, has a group plan of 20 or more, not obligated to go on Medicare, but you certainly can if Medicare is going to make more sense. Now, I do want to mention one other thing. If you are approaching 65, there are a lot of people who what they will do is they like the group health plan, but what they do is they may decide to enroll into Medicare A only, okay? A only. Now, this may be a good decision, but it may be a terrible decision. So again, we're talking 20 more in the group, don't have to do anything with Medicare A and B, though sometimes people will hear they have to take A only. And I promise you, you do not have to take A or B, either one of those. But if you do decide to take only, just remember this. Once you've enrolled in A only, you can no longer put money in your health savings account. In other words, no new money can go into the HSA. Now, that doesn't say flexible spending. It doesn't say health reimbursement arrangement. Those are HRAs, just health savings accounts. No new money can go in once you enroll into Medicare. Now, some of you don't have an HSA, but some of you do. You have a high deductible plan with a health savings account. And so in that situation, I would encourage you, don't even take A only. Now, if you do take A only because you don't have an HSA or you're not worried about contributing to that anymore, keep this in mind. If I have a 20 or more in the group, what will happen? The group plan pays first, and then Medicare takes the second payer position. And sometimes they pay decently, sometimes nothing at all. But the whole point is, you may want to go on Medicare A and B if it makes financial sense. You may want to take A only as long as you don't have an HSA. All right, that brings us then to our third mistake that people make. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. And that is for those who should not, I mean absolutely should not go on Medicare at 65. And so again, this would be anyone, their spouse are working, 20 employees or more on the payroll. Remember, you don't have to do anything with A or B. And again, if you have an HSA, I wouldn't do even A only. But here, I definitely would not do A or B in this circumstance. And that means this. That means you have a spouse that is covered by your plan that is younger and does not have any other employment options at all. The only option they have is the ACA plans, and your income is high enough where you don't get any subsidy. You certainly do not want to go on Medicare because now your spouse is going to have to find insurance somewhere else. And so if your spouse is covered by the group plan, going on Medicare is going to hurt the spouse. We wouldn't want anyone to do that. Remember, children are covered up into the age of 26. And so if your children are covered by that group plan and they don't have other viable good options, again, you go on Medicare, that's going to cause them to lose their insurance as well. And again, we wouldn't want anyone to do that. And so again, some of you should absolutely stay on the group plan at 65. The other group would be those of you that have great coverage. Okay, in other words, you have a great group plan. The coverage is good, the cost is good. And so, again, you don't have to go on Medicare at all. And again, as you do that comparison, and it makes best financial sense to stay on that plan, then do so. There's no problem whatsoever staying on a group plan. In fact, Medicare hopes that you do stay on the group plan because they're no longer responsible for you. And keep in mind, those who should not go on A only would be those that are contributing to an HSA. But again, if you have a great group plan, then stay on that plan. Now, keep in mind, you're going to come into Medicare at a later date. So let's just say that you're going to come into Medicare at age 67. So here's the way we're going to do that. The IEP, that initial enrollment period is 7 months, that allows us to come in at 65, is now long gone. That's 2 years ago, right? So how are we going to come into Medicare? We're going to come in using what's called the special enrollment period. And this is a very simple process. We start the enrollment online, but what we have to do when we have a special enrollment period is we have 2 documents that are added to the process of enrolling into Medicare that weren't required at 65. And one of those, your HR department fills out, called an L564. And this just simply proves that you've had credible insurance coverage. And then we have a form that's called a 40B. And this form just simply tells Medicare when we want to start our Medicare benefits. So let's just say we decide that we are going to come into Medicare. We're 67 years old, and we would like to start our Medicare, let's call it 7/1/2025. So we're going 2 years down the road. So what has to happen is we have to prove through the L564 that you are working back to 65. So if you turn 65 in July, we have to prove this 2 years of credible coverage, which means you were working or your spouse was, and you're covered by a group employer-provided plans, folks, with no gaps at all. So sometimes people change jobs after 65. Well, you want to be sure that you never go without insurance during this period of time, because what makes us eligible for this SEP enrollment is we have to prove we've had continuous coverage all the way back to 65. Now, you may have been with that same company for 30 years, But I have to go back to 65 to make sure that you've had that credible coverage with no gaps whatsoever, and COBRA does not qualify as credible once we're 65. Okay, so the point is the SEP, we have the required forms here has to be filled out, and then here we on the 40B, we tell them we'd like to start our Medicare July 1st, 2025. The L564 proves that we're eligible to do so. So here's my point. Don't panic. You don't have to start Medicare at 65, because if you or your spouse still working, 20 or more in the group, as long as we prove credible coverage back to your 65th birthday, you can come in, no penalties, no problems whatsoever. And just so you know, we start doing this paperwork anywhere from about 60 to 90 days prior. You don't do it any sooner than that. So if someone wants to start their coverage in July 1 of 2025, about 60 to 90 days prior to that, we start making all the arrangements, filling out all the paperwork, get the employer to verify, get all that submitted, make all your insurance decisions, so you have a seamless, very smooth transition to start your Medicare July 1, 2025, and other insurance products that you would need as well can go effective at the very same time. So that's called the special enrollment period. So those of you that have a great group plan, or your spouse or kids covered by your group plan, you want to don't go on Medicare now. That would be making a mistake, and you can pick it up at a later date using the SEP. Okay, let me close out now with this bonus. All right, that finally then brings us to the last mistake people make, which I'm calling the bonus. A lot of confusion about this. So this is somebody that has chosen to go on Social Security, normally early, meaning before their full retirement age. They started maybe Social Security at 62 or 64 or whatever, but now they are approaching 65. So anyone that is receiving Social Security benefits, whether that's spousal, whether that's survivor, whether that's their own retirement benefits, you will be automatically enrolled into Medicare at 65. So auto-enrolled at 65. And so what's going to happen, let's say our date of birth is, again, let's say it's 7/15/1958. We're turning 65, and so our Medicare will go effective 7/1/2023. And so what's going to happen is the Medicare card, watch this, Medicare card is going to show up about 100 days prior to your birth month. So again, before the initial enrollment period begins, Medicare is going to mail you the card. You're automatically enrolled. And so the mistake that people make is sometimes now they're enrolled in Medicare A, and they also have Medicare B, but they're also, or their spouse is still working, and they're covered by an employer-provided plan, member of 20 employees or more. And again, like I taught earlier, anyone has covered by a group plan there, their spouse is 20 or more, you don't have to do anything with Medicare. And remember, if you have an HSA, I wouldn't even do A only. If you don't have an HSA, if you choose to do A only, but the problem here is Medicare automatically put you into A and B. And so if there's 20 or more, what you can do is you actually can delay Medicare Part B. If you're receiving Social Security, which that's why you're automatically enrolled, you have to stay enrolled in Medicare A. You can do A only. And so if the group plan is better than your Medicare options, which usually it probably is, sometimes it's not, we saw that earlier, but if it's better than your Medicare options, then you can delay taking Part B, and all you have to do when the card shows up in the mail, turn it over, and it says on the card, I do not want medical insurance, which is Part B, or you can fill out a form called a 1763, and you can send that to your local Social Security office. But either way, you can disenroll or delay taking Part B. And so when you mail the card back in, or you send in the form, which is the form 1763, same thing will happen. They will drop off the B, and you'll have A only. And then again, we can pick up that B at a later date using what I taught you earlier, the special enrollment period. As long as we prove you've had credible insurance through a group plan, we fill out the L564, we're now eligible for an SEP. So here's the mistake, is staying enrolled in A and B when you have a great group plan. And so if your group plan, that great group plan, meaning what? You like the cost, you like the coverage, it's really better than your Medicare option. The mistake is staying enrolled in A and B, because what happens, now you got to start paying for Medicare B, and because the group is 20 or more, Medicare's in the second payer position. Your group plan's still going to pay first. And so Medicare pays second. So in my opinion, a lot of people have just wasted that amount of money by staying enrolled in B. So if we like the group plan, 20 or more, send the card back in, disenroll for Medicare Part B, and then again, you can pick it up at a later date. So these are the common mistakes that people make. We don't want you to make them.